Hi there, and welcome to Canceling COVID. Hopefully, you had a wonderful holiday weekend as we're coming back to you, keeping it consistent and continuously bringing you information that we feel like you really, really need. As we see numbers starting on the uptick, it's so important to keep you informed and aware of what's happening. A couple of things that we already see happening in addition to the uptick, there are some places that are now bringing back the mask mandate. It's happened in Philadelphia for their school systems inside. Of course, school is getting ready to be out. There may be some summer school, but the school has decided the entire system, indoor masking back with us. If you recall, they tried to implement it for the city and there was a backlash. And so they kind of did a reverse on that. But some universities around the country are now also reimposing the mask mandate. And I see quite a few businesses and schools still sticking on to the requirement for getting vaccinated. So we know you're coming off a holiday weekend. Just want to make sure that we continue to keep you informed and keep you inspired. Of course, Canceling COVID. I have to say thank you to our sponsor. She's with us every week from day one. Groundwater Solutions, groundwater-solutions.org, 704-596-0505. Also a part of the Genesis Project. I brought you up to date on some of that. Here's another fact that I saw, found to be very interesting. Looks like more than 1 in 5 adults are COVID survivors right here in our country. 1 in 5. That's quite a number. So, you obviously have been impacted or know someone or been around. And I think we've established that a long time ago. So why not be informed and know what's happening? And what better way to get you or keep you informed is to bring on my house guest that always keeps me up to date on what's happening. None other than Dr. Tricia Black. So good morning to you, Dr. Black.
Good morning, Tanya. Good morning, audience.
Well, thank you as always for continuously being there for us and helping us. Hopefully you had a great holiday weekend.
I did, absolutely. Rested and enjoyed family and friends.
Great stuff. And of course, we salute for Memorial Day all that have sacrificed and given and continue to serve here in our country. Now, I just talked about 1 in 5 survivors have had COVID here as far as in the U.S. as adults. And we know it's touched every aspect of our life. I think what happens, though, because it's been over 2 years now, people tend to forget the impact and how difficult it is when people come down with COVID. What are you guys seeing now on the ground? As we talk about this every week, you have a pretty good pulse on what's happening in the community.
So what I will say is the folks who have experienced COVID, they don't want to experience it again. We're seeing folks who now have had COVID sometimes multiple times, 2 or 3 times. We're seeing folks who are contracting COVID for the first time. Most are surprised with the severity of the symptoms that they're experiencing. I'd say it's about 50-50 folks who really are very ill. It's lasting shorter times. With Omicron, we're seeing that the illness is briefer. Originally with COVID-19, folks were down, at least a full week, 2 weeks, 3 weeks. And now they're bouncing back after about 3 or 4 days with COVID-19. The symptoms, though, it's really hits you like you're hitting a brick wall. So we're getting a lot of folks who are just shocked. They, didn't think it would be this bad. Now they know what all the fuss is about, because it's not a light illness, and for some, it's difficult to recover fully from.
And let me just clarify the statement that I made. The Center for Disease Control, it's not 1 in 5, 1 in 3 people in the U.S. has been infected more than 3 times the official count. So that's a big difference. So 1 in 3, I stand corrected, 1 in 3 people, not 1 in 5. What I wanted to say along those lines of what you just said, or I should have clarified, it's 1 in 5 who have been infected by COVID, been infected. They may develop long COVID. And that's kind of what you just tied into getting it again, the impacts of it. And of course, last week we had a guest on who talked about the long-term impact, someone that was completely healthy, ate well, worked out, and yet he's still dealing with lung issues. He still has the COVID fog. So, 1 in 3 is a lot different than 1 in 5. Again, 1 in 3 people have been infected. 1 in 5 who have had it already will more than likely experience the long-term effects of it. So, this is.
I think the challenge is that you don't know how you're going to respond to this virus. That is the danger in it. Some folks do, it's like a cold and they bounce back quickly. And then there's some folks that really experience some long-term damage to organs, vital organs and vital systems in the body, because what COVID is doing is robbing your body of oxygen. And oxygen, in the absence of oxygen, that's where disease forms. So so some, they're contracting COVID, and other illnesses are either exacerbated, they wake up, or they form. So it's really important that we control the spread. It's really important that we become as healthy as we can. The gentleman that was on was healthy and still had a very negative impact from the virus. And most Americans are not healthy. We do not lead healthy lifestyles. We don't watch what we eat. We're not active. And so that's really, I think, if nothing else, that must be the change in our focus as a result of the pandemic, that our lifestyles change so that we can live and be healthier all the way around.
So, Dr. Black, I appreciate that. That was a very simplistic way of breaking it down that oftentimes we don't get, is the whole fact that it denies your body of oxygen, and that is what opens the door for other diseases to just slip right on in. Any other updates for us? We wanted to make sure also we circle back on the conversation last week that you had some really important information around Medicaid and your area, your office becoming certified. But before you jump into that, is there anything else that you would like to share?
Yeah, I just want to hit on the terrible tragedy that happened in Texas, and the importance of us focusing not on our physical health, but on our mental health. And I know you've had guests that have focused on mental wellness. It's really important that we are taking care of our brains and our hearts. Those are two pieces. We don't know what was happening with this young man,
Right.
but obviously there was some pain. There was some hurt. There were some unresolved issues. And, as a professional, a mental health professional, I always believe that there had to be signs. There had, but are we watching and are we looking? So I'm encouraging everybody there, just like you go to the doctors for your physical health, find an organization to have that physical for your mental wellness, your mental fortitude, and take your family with you, because you don't know who's struggling with what. And it's important that we avoid folks breaking. I mean, really that was brokenness that
Right.
caused that tragedy. And I do have some compassion for everybody involved. That includes that young man who lost his life as well. Don't know what brought him there, but I do know something brought him to that point.
And
People wake up and just out of the blue do things like that.
And I appreciate you touching on that. And perhaps I should have opened with that. That was going to be in my closing monologue as well, because you're right. I continuously try to uplift mental wellness, and I've got a guest scheduled to come on and talk about that. And we together talked about normalizing the conversation around mental health and mental wellness. And people are starting to do more, but it's just not enough. We've got to continue this conversation, and especially all communities. You've got to make sure you're checking on everyone and making a normal conversation. If there's something even that occurs to you that maybe looks like bullying or whatever the case may be with an individual, and I'm just citing that because this is what runs through my mind, especially with young people, something that they feel like they've been
where
Yes.
everybody was isolated in their own homes. We've had this 2 years of virtual communications where gathering has been restricted. And now that the walls are falling down and we can go back out, many people are still in.
Yeah.
What are we doing with those folks who are still afraid to come out, which that exists? They talked about university students. I know that universities are some are coming up with the mask mandate, but we're seeing that almost 5%, only 5% of students are returning to the campuses, and the professors, that even though now we're saying, no, come back, they're not coming back. So that means that folks are still isolated. We know that isolation breeds mental illness, and we need to be addressing that. So mental health is very important right now. Us reconnecting, connection is important for us to stay healthy. And so I believe that all of that breeds what happened in Texas. We're creating this ground for things like that to continue. We saw Buffalo, we're seeing Texas, and we see it all the time. And we've got to start addressing it.
And to your point, and I also made this, and we can continue to pray, but we have got to start taking some action as well. We have got to start making some changes, holding these people accountable. There shouldn't be a small percentage of people with all this power over the entire country when it comes to some of these nonsense laws that would just make sense. So, and that would be a whole nother story. So let's talk about, though, your center and the certification. Please tell us more about that.
So tailored care management, it's a system to address a lot of what we're talking about. Tailored care management is where organizations will be certified to make sure that folks are working a plan toward health, and not just around their mental health, but their physical health as well as their social needs. So agencies are being certified for care management. I'm saying that we have the ability to do that. We have the capacity and the capability to be able to help folks get healthier. There will be lots of measurements of outcomes. Typically with healthcare, we deliver the service, you hope to be reimbursed, and then you move on. But now we're going to have to show that the folks that we support are getting healthier. So that certification is, we'll receive our certification in early June, and we're very excited about that. But tailored care management will roll out in December of 2022. You will see anyone who has state insurance, Medicaid, will be assigned to a care management entity. And so it's really important for if you know someone with Medicaid or you have Medicaid, that they are doing their research on what the organizations are that are providing this service, and they pick one that they believe is going to do the best job for them. I suggest looking at cultural competence. You can call the organizations, you can ask to come in and talk to them so that you pick the right one for you. And we know historically from Medicaid recipients that when things like this happen, they don't pick. They kind of sit back. Maybe they're not aware that this is occurring. So we're trying to do a really good job of making sure that our community is aware and they know what to do and they know how to reach. You can call us at 704-596-0505. We'd be happy to talk to you about our program as well as some of the other programs in your area.
And so I take it if people, first and foremost, you are one of the selections, excuse me, one of the options. And it looks like in the past, quite a few people, instead of making the selection, they've been assigned. Is that correct?
That is correct.
Well,
here's we're hoping that doesn't happen this time. Well, let me mention one more thing. In addition, there are a certification called Advanced Medical Homes. If you have chronic illnesses that you're trying to manage, you probably want to look for an advanced medical home. Side note, shameless plug, we will also be an advanced medical home. That will not occur until 2023, probably. That's a longer process, but we will start tailored care management in December and then move into an advanced medical home. We do offer primary care services as well as behavioral health services, but we will not have that certification yet. If you have chronic issues, look for you an advanced medical home, because that's a sign that you're going to get more comprehensive care.
Well, we're excited for you. And again, groundwater-solutions.org, 704-596-0505. Please make that selection. And when should they start expecting to see this, Dr. Black? Because I understand that finally our lawmakers in Raleigh are going to approve the extension of Medicaid. So when should they?
I have not heard that. You're saying expansion of Medicaid?
I believe that's the right term that I saw. What we've been fighting for years and hearing that it has not been approved. There are some reports that finally it's going to happen.
We
Which
have been waiting, exactly. And just so the
everyone.
audience is aware, expansion of Medicaid is really important. Right now, Medicaid is only available for individuals who have a long-term disability
Hmm.
or they have what they call dependent children. If you have children under the age of 18 and you are under a set income limit, then as a parent, you are eligible for Medicaid. But if you do not have children, if you have teenagers, when they turn 18, their Medicaid is cut off. And we
Hmm.
know everybody needs health care, everybody needs health coverage. So, with the expansion of Medicaid, anybody who meets the income limit, whether you have children or not, Medicaid will be made available for you. And I'm so excited to hear that.
So yeah, I'm verifying a report after years of refusing to expand Medicaid in the state. Senate Republicans are expected to propose a measure to do so as early as this week, and this is a report out of Raleigh. And it's a pivot for North Carolina, which we have
Hmm.
been, like you said, been waiting for a while, and probably impacted a lot because there's been overwhelming support for it.
Hmm.
A poverty level for a family of three is 23,000. And here in North Carolina, the one part that helps is the Affordable Care Act allows us to expand up to 138%. And I'm just kind of reading off of
Hmm.
how this lawmakers have been trying for months, and it's been unclear, but they're saying they are planning on introducing a law that would help to expand it. And I know it's been
Awesome.
long overdue. So
Mhm.
good news. Glad to be able to share that with you. Glad that you're sharing what's happening at Groundwater Solutions in the Genesis project. That is, I know you've got to go, so I'm trying to get through this so you can head on into your next meeting. But as we wrap things up, is there anything else you would like to say?
No, I just hope everybody, as you go through the summer months, remember that COVID-19 has not ended. It is still out there and it is increasing. So make sure that you are masking, you're continuing to social distance, that your hygiene, you're washing your hands, very important, and you're getting a regular COVID-19 test to make sure that you're aware when you contract and that you do not spread.
Thank you so much, Dr. Tricia Black, Groundwater Solutions. We appreciate you taking the time to talk with us,
Sure.
and enjoy the rest of your week.
Thank you. Have a good week, you all.
Absolutely. Always great information. Keep in mind your opportunity as the information comes out. Don't allow yourself to be assigned to a facility. Groundwater Solutions will be on the list of options. Please support and patronize small Black owned business that's here with us each and every week. Speaking of being here with you, I also wanted to remind you that there are COVID tests. This is the third round. You have an option to get 8 more free tests, not as publicized as the others, perhaps because people feel like they already have 4 and they don't need any more. But mark my word, when we head into the fall, more people will be looking for them. So order them now, share, let people know. COVIDtest.gov, COVIDtest.gov, or you can go to special.usps.com or /test kits, or call 1-800-232-0233, 1-800-232-0233. Some great information. They're free. Just click on a very quick process like before, and an opportunity for you to pick up some additional COVID tests for free, your home test kits. Also, I want to acknowledge Atrium Health. As you share this, please use the hashtag COVID Vaccine Ambassador. Hashtag COVID Vaccine Ambassador. I'm working with Atrium Health to help to keep you informed and to get the word out. We are scheduled to continue the conversation about mental wellness. I've got that coming up in just a moment. But here's some good news. Looks like the birth rate in North Carolina, not just North Carolina, across the country, increased as a result. Maybe I shouldn't say as a result, but coming out of the pandemic, birth rate here in the country, according to the National Vital Statistics System, and it's a part of the Center for Disease Control and Prevention, says that baby boy or baby girl, we've got a 1% increase from 2020. And that's good news as well. It's always beautiful to see new life come into the world. And along those lines, it's always unfortunate when we see these senseless deaths that occur around our country. It's so unfortunate that we continue to see this when there are some steps and ways that can address it. It shouldn't always be about politics. It should be about caring for your neighbor, those that are here in our community, and not seeing so many people suffer as a result of a mental health breakdown, or whether it's racism, or whatever the case may be. When you're talking about the right to bear arms, and you're talking about assault rifles and body armor and a lot of things that are creating so much hurt and destruction, we have got to start taking a stand and holding people accountable. And it starts with our lawmakers. And I made that comment to someone, and they said, oh, they're not going to do anything. It sounds foolish just to say that. But if you believe, and if you trust and believe in the power of prayer, we can. All it takes is a group to rise up and to challenge and demand that things are different. So I would love to count you in as someone that's tired of the hurting and the pain and the senseless loss of lives that are occurring in our country. And there's got to be something done to address gun violence and gun control. Now, there's a huge effort to declare gun violence as a public health issue. I think that's more than well documented. But when I see figures like African Americans, our teens, leading in statistics as the leading cause of death, homicide, and this wasn't the case for what just happened in Uvalde, Texas, but certainly, and I said that wrong, is Uvalde, Texas, but certainly we realize that we've been dealing with this issue for years in our community, and something has got to be done. All right. So it's time for me to move out of the way. As always, life's challenges make you better, not bitter. I'm Tanya Rivens. Thank you for showing up every week. Thank you for your shares. Again, continue to use the hashtag COVID brand ambassador. But most importantly, make sure you be well, be alert, be safe, and check on your neighbor. Have a great week. I will see you on Saturday at 10 a.m. Sounds of Inspiration at Praise 100.9 FM. I'm so grateful that you are taking the time to join us and to make sure that you're informed and aware as we bring you real talk, real resources, as well as real solutions here at Canceling COVID. Have a great day, everyone. Again, I thank you so much for tuning in to Canceling COVID as we work together to have an impact on this disease.